And a very pleasant good afternoon, ladies and gentlemen. Chris here, live and direct from the heart of the high desert, here with our friends at El Paso Physical Therapy Services. And I'll tell you what, it is another time for a checkup, and it is a good one today because we're going to show you a different type of exercise that gets people back on the road. And today we are joined by Chole. Hello, Chole.
Hello there.
And talk a little bit about what you do here, first of all.
I'm a physical therapist and I practice here, and my specialty is orthopedics.
And we're talking about orthopedics today because of this apparatus behind us. What are we going to be doing today?
Well, today I'm going to go over more of the posture. Ultimately, I put my patients on the machine, but postural awareness and finding out a little bit more about your body becomes the very first important essential component.
And it's always one of the parts of the full physical therapy services you get here, not just at this location, but the locations throughout the city. So let's go ahead and bring out our patient.
Okay, all right.
Okay.
So one of the things that I'd like for you to, if we go turn you in the front, is I tell my patients everybody's posture is different. So don't be hard on yourself if you've got a different posture from somebody else. Or don't try to think that, well, can I have that person's posture because I feel mine is different. Work with what you have. And one of the first areas I start to tell my patients is be real aware of something magical back here. So I'm going to turn her around, and this is Rosie.
Hello, Rosie.
Hello. And we've got some shoulder blades back here. Those are called your wings. They're also called scapulas. But you want to know how to have them talk to each other. So I tell my patients we've got some really good muscles that can squeeze these shoulder blades together. And one of the things is you want to learn how to talk to the muscles on the lower part rather than on the top part. So I put my hand here, and then this is what I tell them. Okay, pretend you have a pencil down here, and I want you to squeeze that pencil together. And so now you've started to talk to the muscles of your shoulder blade. Bring it forward just a little, and now you're in a much different position than you were before. I'm going to put her on the side. So kind of slump, pretend you're at a computer. Most of us are on the computer all day long in one way or another.
All the time. I can tell you that for firsthand. And the first words out of my wife's mouth is, watch your posture.
And it's hard. And you know what? Give yourself permission to go forward. That's just the way ergonomically your body will start moving. But periodically you want your muscles to say, let me get away from the computer. Let me give my muscles in the front some rest and get these muscles back here to say hello to each other again. So I call these scapular squeezes, and that's the first exercise. I'm going to teach you two today. One of the first exercises. So let's go over it. These are called scapular squeezes. Pretend you have a pencil and you're squeezing the part. Hold it for 10 seconds. And then after the 10 seconds, go ahead and rest it.
And that's pretty much, really with your posture, once your body's aligned, that sets the stage for everything else to pretty much come into alignment.
Yes. He hit it on the nail. It's learning how to bring your body back into alignment, learning to find out where is my neutral. Is it here in this position, or can I bring it just a little bit further up? We've got several areas that you need to be aware of. Kids, for example, especially in this generation, they are constantly on their phone. They also wear backpacks, so they're like this during the day. Then as you get a little bit older, all high school have to have laptops, and at the college level, so what are you doing? They're slumping down and then just working through. That's real. But they need to learn how to come back up. Now, the lower part of the back has everything to do with how this works. So learn to look at it as one whole piece, because that's where alignment is beginning. And then the fancy word we use, it's the entire leg is like a chain. It's called the kinematic chain. And you want to learn how to talk, where are my ankles, where are my knees, where are my hips, before they hit the low back. And then before they come to this area, and then back up to the neck. So that now takes me a little bit to the neck.
Yeah. Now, again, talking about just the direct alignment, again, if you've ever had a sprained ankle or something like that, and it comes back a little bit weird, well, why are my shoulders hurting? That's the chain.
It could be that eventually, because you're having to favor one side, then everything is tilting, and you're not even aware of it because, like you said, the ankle is bothering you a lot. So you start to compensate without even being aware. And other parts of the chain start to hurt.
It's just like a bicycle chain. If you get a kink in one part, you're not going to be able to go anywhere.
I love that. That's a good example. The last thing that I want to talk about is the neck. So you're at a perfect angle. So remember, sometimes you're at a nice and neutral, but if you're needing bifocals and you don't have correct lenses, this is what you're doing. and you're trying to look at your screen up here because that's the best place, and your head will fatigue. There's others that don't have corrective lenses, so I tell them be real careful with your eyesight when it comes to where's your screen in relationship, because you really want to be in neutral. And that makes a huge difference on how the average human head weighs anywhere from 12 to 15 pounds.
Oh my gosh.
So that's a big heavy bowling ball that you're having to carry up here. And if you're not holding it correctly with the muscles down here, then everything starts to fall apart down here. And at the end of the morning shift, you're just like, why do I hurt so much?
And again, it makes sense because I don't think people realize exactly how much, your body is tied in, but you're not really tied into your body. You're working, you're looking, you're doing this. And I just realized that there's sometimes, yes, even my eyesight is going, I do have bifocals, I don't wear enough, but I will find myself kind of like looking, down my nose, there it is, there's that part of the menu. So that makes perfect sense.
Yeah. And then I want to give you one extra gift, and that's called wall angels. So you ideally want to be behind a wall. So pretend she's right back in the wall. You're going to put your arms in this position. Now, be careful, because if you have shoulder problems, this is going to irritate you. So be real perceptive about how your shoulders are feeling. And if I'm the wall, she's going to slide up and slide back. And we call these wall angels. Just pretend that it has snowed in this desert, which only happens, once a year?
Once a year or so.
And then you're laying down on the ground, and you're doing wall angels. Snow angels, I think that's what they call. So come up. What I'm going to give them cue is make sure your shoulder blades are together, holding that pencil down here. And then if you can't bring them way back here, you can do your wall angels at this level, just until you start to feel real comfortable, because ultimately you want to stretch your pec muscles right here, pectoral muscle, get them out, and then bring them up and down.
So basically, it's just being body aware, knowing where you're at, and then doing what's comfortable so you can get into what you said, that neutral position.
Yes. So 2 exercises. Remember your wall angels that she just finished doing, and then coming back here and doing your scapular squeezes, shoulder blade squeezes, but from this level. Because if not, you're shrugging your shoulders if you do it from up here, from this level.
Yeah, I think we do a lot of shrugging, like, Well, so thank you very much. That is so interesting. Again, this is what we learn here. Every month we come out here to Paso Physical Therapy Services. You're going to learn this, but the best part about it is you don't have to go that far for any sort of therapy services, not just here in Horizon, but throughout the city. Check out the link. We're going to have the link directly to their site. This video will be up on our site and their site as well. And of course, you can hit that link right down there and get all the information, office times, appointments, and what they do. Last word, Chole.
Thank you. If you ever need anything, if you feel like you're getting tired, or you're getting a burning sensation, or you're getting a headache up here, don't hesitate to contact your doctor, and he or she can refer you here, and we can do a quick assessment and evaluation, and to see if something you can benefit from having your postural corrected, and most of all, being aware of where you are.
All right, Chole, thank you very much. And again, thank you guys for joining us. We'll see you in a bit. Keep an eye on if you need any information. It's right here on the link. And of course, for any other news, visit us on horizoncity.com and of course on our Facebook page. But for now, Chris saying, have a good afternoon, everybody.